So GAD, clearly this is a bread and butter diagnosis for latent anxiety. And I mean, maybe even certainly amongst the most common, but probably the top 5 most common diagnoses, if not top 2, that we see. So first, I'm going to talk about the diagnosis of it, assessment measures, and then sort of what do we do? Like, what's the CBT course with clients, starting with psychoeducation, and then some of our core cognitive interventions, and then hopefully there'll be time for a little client reflection exercise. So diagnostic criteria. So let's ground us back in the DSM. So generalized anxiety disorder is characterized by it's when anxiety and worry are excessive. So clearly we all know everyone has some degree of anxiety and worry. And in a certain degree, it's helpful. It protects us. It has allowed our species to survive. But with GAD, it's really the hallmark is excessive worry, where it's no longer helpful. It is hurting us. So it's particularly like the worry piece is kind of what separates GAD from some of the others. I mean, they all involve worrying, but it's more this quality of intrusive worries that are very cyclical in nature. So some of the other criteria, the severity is excessive, and people find it difficult to control the worry. So they might have, worry spirals that last half an hour, 45 minutes, and don't sort of progress to anything more active like problem solving or any more helpful action. So impairment, like a lot of diagnoses, when it becomes the clinical level, it's actively impairing an area of their life. So school for kids, home, jobs for adults, relationships. Generally, it's impairing one or more areas of their life. Let's see. So, technically for the severity, it's occurring more days than not for at least 6 months. And sometimes there are, like I said, 3 or more, but this doesn't always hold up. So 3 or more symptoms. Sometimes it's like that feeling of being restless or keyed up or on edge, easily fatigued, difficulty concentrating, muscle tension, difficulty sleeping. So those all can be associated. Especially, we also see, this is not on here, but often we see with GAD the stomach aches, headaches, so those sort of physical symptoms. All right. So who is more vulnerable to generalized anxiety? So women are twice as likely to have it, not so surprisingly. And then about 1 in 20 people experience GAD at some point in their life. Risk tends to be between childhood and middle age, or I guess risk of onset. But we've seen in a lot of our clients, it can be, people can have various episodes of GAD. So one episode at some point in childhood or teenagerhood, and that sort of resolves. And then another episode happens later in their life based on a particular stressor coming up. So like all anxiety disorders, GAD has a high genetic component. So there's a genetic vulnerability, but then someone's life experiences can sort of contribute to whether that it manifests. So particularly more stressful life experiences or traumatic life experiences can kind of make GAD manifest, but that's not necessary for it to happen. It's often comes along with depression, which is understandable because if someone's spending so long worrying and avoiding and their life is not proceeding as they want, understandably that will take a big effect on someone's mood as their life gets smaller and smaller and they're not doing things that bring them joy. So to assess GAD, our bread and butter measure, we've got the GAD-7. That is, I think it's technically for adults, but I think we use it for 12 and up. I mean, I think I've probably given it to some 10-year-olds as well. And then the SCARED for kids. And as we know, the SCARED has 3 subscales, or more than 3, but it gets at all the 3 anxiety disorders: GAD, social anxiety, and separation. So there's a subscale score. And that can be a good quick indicator of whether it seems like a child has GAD. Although I will say I've definitely seen when parents are doing SCARED, just because the GAD score is not at a clinical level, I would rely a lot on parent report as well. So I wouldn't say that, that you shouldn't delve further just because the scared score isn't clinical. All right. So when we're starting with a client with GAD, we want to start with that psychoeducation piece, and especially psychoeducation about worry and why it's ultimately unhelpful in the extent it's happening with GAD. So can I have a volunteer to read this quote? I really like this description of worry from the Center for Clinical Interventions. Anyone want to read it? This is the easiest form of participation. All right, Miranda, go ahead.
Yeah, I like a participation point. Okay. Worrying is essentially a type of repetitive negative thinking where we get stuck, caught, locked, or trapped in our negative thoughts about future bad things. This negative thinking has a circular, spiral, or snowball-like quality to it because the same negative stuff keeps getting rehashed over and over in our mind, and we have trouble disengaging from these repetitive negative thoughts. This thinking process fuels our anxious feelings, and the topic we are worrying about seems to get bigger and bigger in our mind.
Awesome. Thank you. So we all know the experience of this where, it's repetitive. So those are some of the hallmarks of it. Circular, spiral, because, with people without GAD, I mean, everyone has some degree of worry, but generally it resolves or people are able to kind of disengage from it. But with GAD, there's sort of a stuck quality to it. It's over and over again. It's not really processed. It's not proceeding to anything more helpful. So it's a lot about generating these future potential negative, bad outcomes or negative possibilities. And the worry seems to get bigger and bigger. So, yep, like I said, so people's worries tend to be associated with a whole range of everyday concerns. They often take the form of the what ifs and the catastrophizing. So they're very future oriented. And the big thing that I tell clients is that so people hold some false beliefs about worrying. People assume, never mind, we assume that worrying helps us prepare for things. So if I can anticipate what's going to happen if I fail that exam and how, everything is going to, like the domino effect is going to prevail, and then it's going to lead to, I'm going to fail that class, and then I'm not going to get into it's going to ruin my semester grade, and then my GPA is going to be ruined, and then I might not get into that college. So people assume that by planning out, by seeing all these future potential possibilities, that is helping us prepare. So that is a false belief. So we think that worrying serves to protect us, prevent negative outcomes, and solve problems, but it doesn't. So this is the first thing you're really going to want to help clients understand, that we have false beliefs or misassumptions about worrying. All right, so the next piece you're going to want to do, always, we want to build awareness of the problem. So I always like starting with a tracker, and specifically a thought tracker. So for this one, or a worry tracker. So for this one, let's see. So I'll have a client I'll often share a Google Sheet or something where they can either handwrite this or type it. And they're going to keep track of instances where they notice that they're caught up in worrying. So, you could write what's the day or the time, what the situation or the trigger was, what are the content of the worry thoughts, and if there's any other experiences, physically or, what the feeling label is. And then what I like to throw in to begin, because when you want them to get a sense that it's not helpful, that the worrying is not productive. So I add a column that in which they have to determine, is my worry about a current problem, like that can, potentially be solved, or, there's some degree of control over, or is it about a hypothetical future possibility? So you're wanting them to get a sense of how much control do I have over this? So then, if you realize that you don't have very much control and it's so hypothetical in the future, that's grounds for, you recognize it's not helpful. I need to disengage from it. It's not serving me. Whereas if you're determining that actually I do have some degree of control over this, then you can take more of an active problem solving approach. So I try to keep this in the first tracker, so they're beginning to get a sense of, is this worrying helpful? So let's walk through one of these examples. Okay, so let's say this is a woman in her 30s. So the situation, Monday morning, she's at work. My boss assigns me a work task that I'd never done before. Right. So her worry, what if she finds out that I can't do this task? What if she regrets hiring me? I mean, you can go on and on and on. Okay, so this happens and she's sweating, her heart's beating really fast, she has GI distress, and she spends the whole day then sitting at her desk perseverating over this worry, and thinking about potential things she could do but not acting on it. Okay, so in this case, I would say, is this a current problem or a hypothetical future? I'd say in this case, it's a current problem. She has a task that she doesn't know how to do. Does she have any control over it? I mean, obviously, this is going to be very dependent on the particular context. But let's imagine that, yes, there are things that she could do to help for her to learn how to do the task. She could try to ask a colleague. She could try to, look on the company intranet. She could take some steps to research how to do this. And clearly, like, she could always ask her boss. So that would be example one. Let's say, I'm going to skip example 2. Let's do, middle of the day Tuesday. So this is the same woman with GAD. So she's sitting at her desk and she's realizing, oh, my sister is driving back from college right now. And it's raining really hard outside. Okay, so I'm going to want some audience participation. What's potential worry that she could have in this situation? Both, I saw 2 hands. Joey, and I missed the first one.
I think Danielle.
Danielle, go ahead, and then Joey.
I was just gonna could be worried that your sister's gonna get in a car accident driving home.
What if she gets in a car accident? Yep. Joey, do you have another one?
My brain went to, like, what if the car, like, shuts down, or, like, whatever the word is, and she can't get it running again.
Yep. So right, the car shuts down. She gets to the side of the highway. It can't move. She's in a maybe dangerous position right off the highway. Good. So this is the woman imagining this fear fantasy about her sister. What are other experiences she could have? Like anything physical? You got Danielle and Joey can pipe up. Any potential physical symptoms that she might have?
I was gonna say, like, once your heart starts beating, maybe she remembers like a previous car crash or something, like that kind of a thing, where, yeah, maybe it's happened before.
Yep. Like she remembers from her life or something she read about that's about a car accident.
Yeah.
Yep.
I was just gonna say any panic symptoms, that we know of.
Right.
Sweating, heart racing,
right.
Trouble swallowing, like just the racing thoughts.
Right. So what impact is that going, if this is how she spends, 10 minutes, what impact is that going to have on her life or on her day? Let's say she's in the middle of the workday.
I mean, if it's 10 minutes right now in the middle of the workday, but this came from having a thought.
Right.
We have thousands of thoughts every single day. So like the amount of time that she would be spending worrying, she wouldn't really be able to be present in her life. So she would. It's also probably not enjoyable to be. It's also not enjoyable to be worrying all day long. But she also just wouldn't be present. Yeah.
And so even if like she contains it a little bit, she moves on to a work task, it might pop up again, and then she's on the same spiral, and then so it could be repeatedly coming up. So would you say this last column, current problem or hypothetical?
Hypothetical.
Yeah, hypothetical.
Yep. There's been no evidence that this has happened or is even close to happening. All she knows is that, her sister is somewhere, is supposed to be driving home.
And she has no control over it either. So that,
No control. Yes. So is worrying at all productive? No. Yeah. So this is right.
I have a question about that.
Yeah.
Because you can logically know that the worrying isn't productive, sometimes you just can't stop it. Like I had a client yesterday who I was talking to about something similar, about like he had an urge to do something, and he was just like, well, I know that like I shouldn't do it, but I want to do it and I'm going to do it anyway. Like it's like sometimes you just can't stop it. And so he was like, well, what can I do to stop it? And I was like, well, sometimes it's not about stopping. It's about accepting. I don't know. But in this case, it's like hard because you don't want to be worrying all the time either.
Right. We will get into that. But yes, so we've got our cognitive interventions and then our more act-based interventions. So accepting and defusing from the worry or actively challenging it. But yes, we'll get there. But yes, worrying can be very hard to stop, even if you rationally know that it's not helpful. Right. So that's sort of the awareness piece. So first having your client do some tracking and then reflecting with them on, are there any patterns or what topics do you notice that your worry hits on? Does it tend to, stick around for a really long time? Does it tend to punctuate throughout the day, coming back? So just sort of noticing those patterns and the pattern and noticing how many of your worries are actually about current problems or hypothetical. So then, our bread and butter CBT intervention, cognitive restructuring, which I tend to start out with, even if that's not going to be what really sticks for someone. Because I think it's a good exercise initially to see whether, are people able, how much insight do they have into whether that these worries are irrational or not. Okay, so cognitive restructuring, challenging the accuracy of your worries. So, I like to start by using a thought log, and which has a structured way to show people how to take their worry thought and then examine the evidence for it, examine how accurate, helpful, and realistic it is, and then shift it into something that is more helpful, realistic, or accurate. So there's a zillion thought logs out there, and I've tried a whole lot of different ones, but generally a format that I like is where they're writing down what the content of the worry, what is the worry thought or the anxious thought, what is evidence in support of it, what is evidence against it, and then what is a rational counter thought. Okay, so this is going back to the first example. So if she were to do some cognitive restructuring of her initial worry that her boss is going to find out, my boss might find out that I can't do this and then regrets hiring me. So that was her initial worry. Okay, so if she were to be asked, what evidence supports that? And we know that the evidence in support may actually may not hold a lot of water, but she's going to say, well, I once overheard her on the phone, on the phone call, telling someone that they'd made a mistake hire. Well, she doesn't know that this was about her, but that's going to be evidence that she's going to point to as grounds for why her boss might regret hiring her. All right, so she might have other evidence like my boss kind of frowned at me yesterday. Maybe that's because she was already, not liking my work. So we can also then help the client challenge, whether this evidence really is in support of the worry thought. Because a lot of times that evidence is like they're making a lot of inferences, they're, filling in gaps that aren't really there. So evidence against, why the worry that her boss might regret. Well, my boss has responded generally well to everything I've handed into her. She did say that I should come to her with questions. If I don't understand parts of the assignment, she probably expects that a new hire is going to come with some questions. It's not going to annoy her or certainly not make her think a lot less of me and my work. All right, so after that exercise, you help the client build what's a more rational interpretation for this? Well, my boss understands that I'm still learning the ropes of this job, and my asking for help is unlikely to drastically change her opinion of me. All right, so a lot of times clients can get to this point. They can come up with a rational thought, like in this, isolated exercise, but it's different to actually believe it, as we know. But I think the exercise of still coming up with this and actively challenging the anxious thought is still good, even if it takes a really long time for people to generalize that in the moments when it's happening outside of the therapy context. Right. So I need another participant. We're going to take one of these examples and we're going to fill out this an entry here. All right. I need a brave participant. We'll just do one and you can pick whichever worry thought. Okay. Suhei, perfect. All right. Which one do you want? Which worry thought?
This could be skin cancer.
Okay. So let's say this. What do you think the trigger was?
I saw something on my skin.
Okay. Yep.
Oh, okay. Do you want me to go through
Well, I guess
it?
I'll be the therapist and you're the client. Okay. So say this is the same, 30-year-old woman with GAD.
Okay.
Maybe she sees a mole. This could
Okay.
be skin cancer. All right. This could be skin cancer. All right. So tell me what evidence shows you that this is skin cancer? Where is the evidence?
Okay.
What makes it likely that it is?
Yeah. I usually look at this part of my body often, and I feel like I always look at it and I think it's like getting bigger. So I'm pretty sure it's skin cancer.
You think it's getting bigger. You look at it a lot. Okay. Okay. So that something's getting bigger to you may mean that it's skin cancer.
Mm-hmm, mm-hmm.
Okay. Do you know that about skin cancer? That if a mole is getting bigger? I mean, I know that well, again, this gets into like how much information you know. I mean,
Right.
yeah, moles changing. I know I've heard that moles changing can mean something about skin cancer. Okay.
Yeah.
Okay. So that's your evidence and support. It looks a little different. It looks like it's getting bigger.
Mhm.
Right. What's the evidence against it? Why might this not be skin cancer?
I'm not a doctor, and I'm over analyzing this mole like a lot.
Right.
And so I think I'm just putting my own worries on it.
So you may be a little clouded. You're looking at it so much.
Yeah.
It may actually not be changing, but you're so vigilant that you're kind of seeing it a little bit.
Mhm.
You're coming in with a bias.
Yeah.
All right. So you don't know for sure that it's changing.
Right.
You don't know for sure that just because if it is getting bigger or it is changing, you don't know for sure that means cancer.
Mm-hmm. Mm-hmm.
All right.
Yeah. It's hard to accept, but yes.
Yeah. So it might not. At least there's the possibility this might not be cancer, and maybe even it's unlikely that there's skin cancer.
Mm-hmm.
We could go into other questions like, have you been to the dermatologist? Like,
Right.
what has been the outcome of that? Has the dermatologist said that there are certain areas to look out for, keep an eye on? So we don't know those details, but just based on this. Okay, so Suhei, what would be a more helpful thought to have when you look at that mole?
Yeah. I take care of my skin by putting on sunscreen.
Oh, yeah.
And I do the best that I can, and I will go to my dermatologist to check on it when I set up my appointment, just to confirm it's okay.
Right. That's a really good one. Like, there is an action step you could take
Yeah.
to really see if it's a concern. I can go to a dermatologist, but right now I'm not going to do anything about it.
Yeah.
Good.
It'll be hard, but I could do it.
Yeah. Yeah. But also like so with that, like, is this a current problem or a hypothetical?
Current problem? Because if I had the mole,
kind of go either way.
right?
Yeah.
Yeah.
I mean, the worries are about hypothetical, like it could be
right.
skin cancer, but yes, the mole is right. You're looking at the mole. It's happening in the present.
Yeah. Yeah.
But yeah, you're right. So there's some degree of control. Like, you can do something about it. You can go to the dermatologist. It's not going to happen right now, but yes, that's an action item that you can turn this into more of like something that's more, you're going to get actual resolution or solve the problem rather than just sit in that worry.
I see. So like even though like my appointment's coming up on X date, I could think about it for like 10 minutes, write down my worry thoughts if I think that's going to help me, or just like, I don't know, fantasize about it
Right.
and then worry that day once the appointment comes up.
Yeah.
Cool.
Right. So if you have the appointment, like there's nothing you can do about it now
No.
or before the appointment.
Yeah.
So
That's
good.
such a really good question. Just that,
Oh, yeah.
Miranda, what language can we use that might be helpful for kids to understand current versus hypothetical worry? That's a great question.
Yeah. I mean, I think I stick with the control. Do you have any control? Is there anything you can do about this right now? Do you have any control? What do you have control over? What, if so, what is something, what do you have control over? And then what are things you don't have control over? So like, I don't know if a kid probably wouldn't have the mole example, but maybe an example for a child would be, something more somatic, like, if their stomach's hurting a lot, like, what if this means I have, let's see, what would be a kid, what if it means I have stomach cancer, or what if something's really wrong with my stomach? So you could ask like, well, okay, your stomach hurts right now. Do you have any control over this? Well, I mean, what control do you have? Well, I can try to go to the nurse. I could get some help for it. I could have someone to check it out. All right. You can go to the nurse, and then you're going to wait to see what the nurse says. But sitting there worrying about it isn't going to help. So one small thing, you can sort of get it checked out. That's one area, like something you can do that's in your control. But other than that, you can't turn it off. Like you can't flip the switch to make it stop hurting. So we recognize like, what are some small things you could do? Any steps you could take to resolve whether this worry is a problem or do something about it. But yeah, I think I would stick to the control or not control rather than current or hypothetical. All right. So that's our cognitive restructuring, which I know we do a lot of. This is just, I've got so many tools I use for cognitive restructuring, but I tend to like having a list of questions. Like for adults, I'll, call it the Socratic questions, or, questions to challenge negative thinking. For kids, I like using detective questions and using language like, we're a detective and we're going to try to figure out whether it's, whether this worry is true, or whether, how true it is, or how helpful it is. And then, so these are some of the questions that I use to prompt it. All right, so that's cognitive restructuring. So now, I mean, as we know, we want to get at what are some of the core fears. So, people can have worries about the same topic, but when you really kind of draw them out, you want to do some exercises with clients where you're getting them to really trace out the worry so that you can get it. Is there something more, some common theme behind the worries that are really their core fear, or the major, underlying thing that they're afraid of? So I think we've all done downward arrow experiences before with clients, or, exercises on ourselves. So downward arrow is just like continuing through the worry chain. So you start with the first worry that's coming up, and then what would that mean? And then what would happen? And then what would happen? You kind of want to get it down to, the worst of the worst. Okay, I'm not going to really go through this one. So those were our cognitive interventions. So now, obviously, exposure. So what does exposure look like for GAD when clearly it was with some of these catastrophic worries, we can't make them happen. We wouldn't want to make them happen. So obviously a good way for when we can't actually have the person face the thing they're afraid of is writing a worry script. So writing a story that details the worst of the worst happening. And the idea of doing that, even though it can seem a little masochistic to ask a client to do that, is that so much of is that we don't actually, when we're thinking about these worries, we don't often, they appear as these blurry kind of worst case. We just see the end result. We don't actually, and we don't sit in that discomfort for a lot. A lot of people, they'll come up, the worry will hit, they'll quickly see the worst outcome. Like in this case, I'll never be present for my family or emotionally strong. Like they see that in a flash, and then it's so distressing that they kind of suppress it or they move away from it. That sort of avoidance approach. So because that's, as we know, like suppressing that and avoiding it is just going to make it come back. So the point of doing a worry script is that you're making someone have to sit with those feelings that they don't want to. And also that they have to, if they really were to trace this whole scenario that starts with like one small worry and then balloons into this big thing, by going step by step through it and tracing it out, you're actually realizing all the things that would have to happen for it to end that way. And a lot of times, because people just quickly see like the final scene in the movie, they don't think through, well, that would have to happen, and then that would have to happen, and that would have to happen. And they're also realizing like, well, there's a lot I could do to prevent, step D to step E. And wow, like it would really take a lot for all these things to happen. So that can be the benefit of the worry script. So actively experiencing those negative feelings and seeing all that would have to happen to, for this worst case scenario to come. And then by rereading the script, you're habituating to those feelings. All right, so that's the cognitive, the exposure piece, and then an intervention I'm sure we've all used before that I really like is designating a worry time. So the benefit of the worry time is that, imagine I like for people to do it in the afternoon or the evening, not too close to bedtime, but later in the day, so that it allows you to disengage from the worry as it's popping up throughout the day. So when it pops up throughout the day, the client's going to say, I'm going to shelve this for worry time. Like, I'm going to put this in my worry time inbox. I'm not going to deal with it right now. And you get some sort of relief in knowing I will deal with it. Your mind gets that, like, I'll deal with it. I'll face it. But right now it's not time. It's not my worry time yet. So it can contain it a little bit and then help people, disengage from the worry as it's popping up throughout the day. Yeah, and it's also just good. It's helping you develop that skill of disengaging from the worry in general. And this is a great intervention to use with kids as well. Having some people like to write it out, a worry journal, or I guess you could write, put little slips of paper and put it into a jar. People could just narrate it out, whatever format that works for them. I generally wouldn't do 30 minutes a day. Maybe I do 10 minutes a day. And often what people find is that if they really sit there for 10 minutes to worry, you actually can't really fill it. You can't fill up the time. You think that you can, but you can't. All right. So this is the video. I think this one, she gives a really helpful, there's some psychoeducation about worrying. And then she talks about some strategies to remove to disengage and put your attention on something else. It's about 6 minutes. Let me see if I can see when I'm trying to click on it, it's not letting me play it.
Okay, is this yes, I would say just move on. Is this a slide that you created or maybe used from?
I used from the other one. From the first
so it's probably live on that one, but to copy and paste
it's
into a new one,
live.
it's not live, which is okay. I think we're getting the gist of it, and I can certainly when we put this into a training, I will find the one that is live, and people can watch that as they're doing this training as well.
Okay,
so that's a-okay.
Well, so I think people should watch this because it's really helpful in giving the providing some psychoeducation. I show this to clients too. But she's talking about how every time, how worrying is unproductive, and how we have, when a worry pops up, then we get that uh-oh feeling. And then the need to worry is sort of, it's reinforcing the uh-oh, and then we worry, and the worry gives us some relief. So it's sort of how worrying is a compulsion. And how it's this reinforcement cycle that the uh-oh, and then we start to worry, and it gives us a little relief, but then, not relief in the long haul, in the long term. But she talks about how, this does.
Hello, everybody. Welcome to our webinar, Stop the Worry Cycle, featuring Carrie
Can you guys hear this?
I can't hear it. Does it look like you can fast forward just for the sake of
These
Okay.
time as well? And I can certainly send
Yeah.
this to everyone, just depending on how much more you want to get to. I know there's a lot of great information here, Dr. Mitchell, so I can send it to everyone afterwards to watch as well. Yeah.
Okay, that's fine. So her point is that to break this worry loop, that we often worry when we're in this something called default mode, when our mind is wandering or it's not focused on something. That's when the worries pop up. When we're not actively engaged in a task is when our mind can wander and daydream and the worry pops up. So when we're caught in this worry loop, to purposely move our attention onto something else that engages our mind, takes us away from that, gets us out of that default mode where the worrying can pop up. So purposely break the worry loop by engaging your attention on something that actively requires it. So she has these, there's 4, these are basically it's like a form of, different categories of coping skills, but they're specifically about re-engaging your attention on something else. So one of the categories is attention centering activities. So going to that, breathing and mindfulness or visualization or body scan or any of those good kind of relaxation or mindfulness approaches. Sometimes I don't find that those are always engage our attention. I mean, we're still, there's still, the words are going to pop up, but maybe doing something that's more like a mindfulness exercise that's guided, where you really have to follow along. So attention centering activities are a way to break the worry loop. And then she's got a couple other categories like expressive and creative, reflection, exploration, where you can actually kind of ask questions of the worry or challenge it, so that the cognitive restructuring would kind of fall into that, journal about it. And then of course, like more, lifestyle, doing more behavioral activation, like doing things like connecting socially, exercising, that get us, occupy our attention and get us out of the worry loop. So definitely worth watching that clip. She does a really good job explaining it. All right. So does anyone, before I go to our reflection exercise, does anyone have any questions? I know this was a lot of information on a big topic that we deal with. Alexis?
Hi, Dr. Mitchell. Also good to see you.
Yeah.
I have a question about the worry jar, because I do think it's a great exercise, but I have difficulty with it. Like for the example you gave about the client whose sister was was driving. Like I have clients who would be like, well, I need to work on this now. I need to call her now. I need to fix it now. Like it's going to be too late. So what would you say to someone like that of like, I need to be proactive or I need to do something?
Like when they're doing the worry time or when they're just thinking about it throughout the day?
Like, yeah, like if it's happening right now and you're like, okay, set the worry time for 4:00, but they're like, but it's right now.
Yeah. I mean, so by calling their sister, right, that would be a natural one, because like you would get reassurance that that's not happening.
Right.
I would say no. The point of worry time is just to get the worries out there. Is to let yourself like do the thing that's not good for you.
Right.
And then, I suppose so in the context of the worry time, like just doing the worries, I suppose maybe that's something they could do after. Like maybe it would be, all right, you put aside the worry time, and then if it's still bubbling up or it's still bothering you, like you could do something to get some reassurance.
Mm-hmm.
But yeah, generally I would say the worry time is really just letting the worries go. But I mean, if you just kind of like I talked about with the determining whether there's some control, the goal is that if you can, for clients to recognize if this is something where there is some control over it, turn it into more problem solving, because that makes it more like, that's more helpful. That's more like where you're actually going to resolve something. A lot of times worries don't have a problem solving because they're all of these future hypothetical. And I think in this case with someone checking on their sister, like that's not solving the problem. That's giving them reassurance that that's not happening.
Yeah.
But yeah, I mean, so ideally, like people could start in their worry in the worry journal and realize, oh, actually there's something I could do about this. Like if you're worrying about, oh, that interview is going to go horribly tomorrow, like, what if I just, what if I freeze up, or what if I, we hit it off wrong and there's not chemistry, or right. You could spin out all the worries, but then, maybe that would lead to, well, okay, actually, I think there is something I could do about this. Like maybe I should spend some more time preparing. Like that's something that's more actively going to prevent these bad outcomes. But yeah, I'd say for the sake of worry time, obviously, like just getting that reassurance by calling your sister, that's just reassurance seeking.
It's different. Okay. That's helpful.
Yeah.
Thank you.
I actually had a child client who was worrying a lot about, sort of like death, existential anxiety, and particularly about like, the death of her grandma. And she started, and she would get reminded of her grandma when she saw there was like a necklace that was her grandma's, or anything around the house that she saw of her grandma's would set that off. She started doing a worry journal, and it was really like that kind of took care of the anxiety. She kept the journal for a week, did it once every evening, really liked it, and then it was like the death anxiety was gone. Temporarily, but it was one of the most successful worry journal activities I've done.
So I have a 10-year-old client, and she excessively worries about fire. Kind of ever since they did a presentation at her school, like where a fireman came in and they showed videos of it, it kind of always kind of comes to her mind, especially at night. So then she'll go and check on her parents to make sure they're okay. So I think where we're kind of having a hard time with that is like, what can she do when it's nighttime, her room's dark, like not doing a worry journal, because that would involve like having to turn the lights on, like things like that. And that's where we're kind of coming into like a
right. So her worries are like the house might get caught on fire at night.
Yes. So she also has
bedroom or
so she also has some compulsions to where she'll move her trash can multiple times and make sure it's in this correct spot. So it's not too close to her bed, not too close to her bookshelf. So in case it catches on fire, it can't catch something else. And so I had her draw like her worst fear, and it is, her house catching on fire, her parents being inside, and her sister being outside. But so some of it's just like that excessive worry at night too. And I'm kind of trying to figure out like what are some maybe things she can do.
Right. Have you gone through some sort of cognitive restructuring where she's looking at all, for when there's those safety concerns with like your house being safe, oftentimes for kids to learn about, all the different precautions for fire and all the reasons why it's so unlikely that it's going to happen.
Yes, we've gone through that. She knows. I think she's even taught me some things about it. All right. So she knows all of it, but it's still.
We use a flame retardant material on our roof, and all the. I think like that could be a case for writing out some coping statements.
Okay.
So I think of coping statements not necessarily as the rational counter thought that could be, that's more involved, but a coping statement like, I'm safe, my family's safe. Fires are incredibly unlikely. Just very simple ones. Even having those written out near her bedside.
Okay. Yeah, because she has her like some coping strategies like that she wanted to do, like hugging stuffies or listening, humming Disney songs, like different things that we've done. But I think sometimes in the moment, she has a hard time remembering, even if it's right by her bed, because her parents said it's right by her bed. And then even one time, I guess it was, she thought she smelled fire. So then she went to her parents and there was no smell of fire, but
so having those things those things close by, so things that will soothe her, maybe just distraction too. Like I said, when kids are worrying during the night or before bed, like that's when reading a book, just something to get your mind off of it. And then having the coping statements and ideally she wouldn't go. I mean, does she do a lot of the reassurance seeking by going and checking on her parents?
Yeah, she's doing it less, but she will go check on her parents. Sometimes she'll wake them up, like just to make sure that like they're okay.
To wake them up, because clearly she could see if the room's on fire. I mean, maybe you can give her one pass. Like you can get one pass a night where you can do a check, but then once you've used your pass, you can't.
Okay. Yeah. Thank you.
It's so hard when that happens at night for kids.
Yeah.